You want to know first of all?
Just basically tell them who are you, where you come from,
Okay.
what are you doing here right now.
Okay. Hi guys, my name is Jennifer, and I'm a nurse. I'm from Nigeria, and I've been a nurse for 11 years, and I moved to the United States 2 years ago from England.
Okay,
Is
that's
that
good.
it?
That's good. That's pretty good.
Mhm.
So before I get started,
Okay.
um, I think it's important for our viewers to know that even though we're basically doing these the little introduction, so I'm Jamarli, she mentioned, she's Jennifer, and last week you saw Raphael. So basically, we're gonna be the basically like the host of this podcast, and I think it's important for us to basically just introduce ourselves so that when we start doing reviews of different stuff, you guys know exactly who's talking and who is doing what. So um, I guess with that, let's begin. All right, let me say it. How did your nursing journey started?
Okay. So it started back in 2013. After I graduated from nursing school. Nursing school is quite different from, I don't know in Jamaica.
Yeah,
I think you guys have colleges, right?
yeah, we do have
Okay.
colleges back home.
Okay. Okay, now we have colleges because they changed it. But mine was nursing school. And then you go for, I think, about 3 years program. Then after the 3 years program, you graduate and then you take your licensing examination. And then, which is just like the NCLEX.
Okay.
And then after that, you get your license. So in 2013, I graduated and then I started working almost immediately. So I worked at a pediatric hospital for a few months before I got a job at a clinic. It's just like occupational health nursing.
Yeah.
So I stayed there for like almost 6 years. So the first year, actually, I worked as just a new RN.
Yeah.
And then after that, the HOD, she had an opportunity to relocate to Australia, so she left, and then we had no HOD, so that position was opened.
Yeah.
So I was like,
And,
why
and
not?
for our viewers who don't know what HOD is, what's that?
Oh, okay, I'm sorry. It's like head of department. It's just like DON, director of nursing.
Yeah.
Yeah. Okay, so let me not confuse you guys. Director of nursing here, I know you have to go through the MSN masters. You have to go through the administrative nursing before you can be a DON. But back in my country, no, basically it's just experience and opportunity before you can become the HOD, head of department, or
Oh, really?
director of
That's
nursing.
crazy because yeah.
It also depends on the facility. My facility was my facility was not as big as the hospital.
Hospital.
Yeah,
Okay,
so
okay.
the hospital you need to go through stages from RN to chief nursing officer to charge nurse, chief nursing officer. So,
Yeah.
but mine was a private facility, so
Okay.
yeah, it wasn't as yeah.
Okay,
So
yeah,
so I
yeah.
had the opportunity. I was like, yeah,
So you applied for the head of
you
department.
know, it's just you don't apply
Yeah.
because you are the next in line. They give it to you.
Oh, well, really?
Yeah, so I became
know,
the director of nursing.
Yeah, from hearing from you guys, I think Nigeria is a very interesting place. I'm gonna have to
Very
visit there
important. Yeah,
sometime.
yeah. And when you visit, I promise you won't want to come back because
Oh, really?
it's fun.
Yeah. I figured that because based on what you guys have been saying, I'm telling you, it's very interesting.
Yeah.
Last week, Raf was telling us that going to university is not necessarily a matter of qualification, but
No.
it's more a matter of links and stuff
True,
like that.
true. Yeah, true.
And that
And
was
that's
pretty interesting because,
yeah.
even in Jamaica, yes, there is a certain degree to which we have to have links back in
Mm.
Jamaica, but I think one of the main thing is that your academic performance has to be like up to standard, and
Yeah.
you have to perform at a certain level so that they can see that even with perfect academic record, you still have to have certain level of like voluntary contribution, like participate in voluntary group. Having like a 4 point GPA is not the only qualification or requisite that these universities back in Jamaica
Oh,
accept. So it's pretty interesting hearing your perspective. So how did you make the transition in becoming like a nurse in England?
okay. So after working in that facility for like almost 6 years, so we had the opportunity. In fact, but my husband had the opportunity to go to England, so I had to stay back
Yeah.
with our son. and then he stayed there for a few months, and then I had to go move to England with our son. So when I got there, I took the exam,
Yeah.
and the exam is not like English. You have to take the CPD computer based test, and
Yeah.
then you take the theory.
What's
I'm sorry, the practical. So the practical, they call it OSCE. Um, I don't know the full meaning, but I know you're gonna put it there. I forgot to.
Yeah, yeah.
OSCE is SCE. Yeah,
Okay.
OSCE. Yeah. So that's basically one of the most. It's very serious.
Okay.
So if you have cameras all over the place, and then if you miss a point, maybe you don't wash your hands for the 20 seconds, you're in trouble. Something like
Wow.
that. Yeah.
That sounds much different than what we had to do here.
I found this on the web for one of the most.
Yeah. That sounds much different than what we had to do back in Jamaica.
Oh.
No, not in Jamaica. In Jamaica, I think it's basically the same because Jamaica basically operate from the English syllabus. So we had to do like a practical or practical. Trust me, our practical was like it's serious stuff. That's basically you only have 4 attempts in Jamaica. You only have 3 attempts in becoming a nurse.
Whoa.
If you fail those 3 attempts, you can never become a nurse in Jamaica.
Whoa, that's serious.
Yeah, it's very serious. So that's like, so you'll be going to nursing school for 4 years, spending almost $2 million, and if you fail those 4 attempts, you will never become a nurse.
Oh, that's sad.
Yeah, so it's very serious. So basically, with their practical though, it's like something that runs from like for like 4 hours.
Wow.
You have to go through the whole phase of being a nurse. You got to like do your assessment, serve your medication,
Yeah.
perform like a sterile dressing, some sterile technique, either catheterization, sterile dressing, and those are very serious because if you make one simple mistake, you're out.
Yeah.
And those guys don't mess around. It's not even like if you started crying, they're gonna say,
Yeah.
"Oh, have some sympathy" or stuff like that. Yeah,
I
so,
think it's similar to that of England. It's
Oh, yeah?
similar, yeah. It's
Wow.
similar, yeah. Because they won't even speak to you when you make the mistake because there are cameras there and there's somebody sitting down there, she won't say anything. So
Yeah.
it was that bad. And then after that I got the license and I worked there for almost 2 years.
2 years. Oh,
Yeah.
that's good.
Almost
So
2 years.
did you work in the
Almost 2
acute
years.
care setting or you work like in a
Okay, so
nursing
I
home?
worked in a nursing home.
Okay.
Nursing home, yeah. I worked there. But I worked there for in fact I was working there and I was also doing agency nursing. It's more like you go from it's still agency nursing here, the same thing here where you go to one facility or the other to work for them. So yeah, I was just doing that as a side.
Okay.
And that's what I worked there.
All right. So, especially practicing nursing back in Nigeria and then you moved to England, what were some of the challenges like basically adapting to the way they practice nursing in England?
Honestly, it was tough.
Oh, really?
It was really tough because back home, like I said, I mentioned that the facility was not as big as like hospital setting.
Yeah.
There might be like people that worked at the hospital, they might find it maybe easier to acclimatize. But for me, I'll say because it was an occupational health setting and I wasn't even exposed to any nursing home. So we don't even have nursing home back home in Nigeria.
Yeah.
No, we don't.
It's pretty much the same in Jamaica.
Yeah, we don't have.
I think in Jamaica the closest thing we have to that is like senior citizen are. We also have some places that they call it's not like I wouldn't say it's up to date like here in America because when you go there, persons who are classified as patients are literally madman walking on the street doing doing all type of stuff. So yeah, it's not as controlled as in America here.
Yeah. So we don't have that. So going into a nursing home or working at a nursing home was just strange. Same people there, you give them medication, you give them food, you take care of them. It was actually strange. But I had the right number of people to support me, and because it was England, I had so many people just like me, people of color. They were there to support you from Africa. They were still there. They understand where you're coming from.
You had a lot of Africans over there.
Of course.
Wow, Nigerian, of course, right?
Nigeria, Kenya, Zimbabweans, or what do they call them? Yeah, I had lots of them. I even had Caribbeans.
Caribbeans?
Yeah, I had Caribbeans, I had Jamaicans, and Dominicans.
And which part of England was this? Was it London?
It wasn't. It was close to London, but it was like Cambridgeshire. Cambridgeshire. Yeah, they call it Cambridgeshire. It's like a county.
County. Oh wow, yeah.
Yeah, so it was.
Heard of that. Yeah.
Yeah, that was where I worked, and then they supported me. Even they made what they call them. It's just like director of nursing.
What's
Director of nursing. what do they call him? I forgot what they call him back in England. Manager. Yeah,
Manager.
yeah.
Okay.
My manager, she was very supportive because she's from the Caribbean as well. She was very supportive, and
Do you know where from the Caribbean
yeah,
she came from?
she told me. I think it's
St. Lucia,
no, it was
Trinidad, Barbados,
Grenada?
Guyana.
Guyana. I
Guyana,
think
okay.
yeah, either Guyana or I know she's not Jamaican,
Oh, she's
but either or Dominican. No, it's Guyana.
Guyana,
Yes,
okay.
yes. So she was there. She was very supportive, and then yeah. So that's how I was able to skate through. So if there's anything as little as that blood sugar pen.
Yeah.
It was so confusing. I was like, "What's this? Is this a pen or something?" It was so confusing. Like, I've never seen this in my life. What is going on here?
So in Nigeria, what were you guys using to test blood sugar?
We have the what's it called? The glucometer.
Yeah.
We have it. But I'm talking about the insulin, that insulin pen?
Yeah.
Yeah, that's what I'm talking about.
Oh, the one that you basically calibrated.
Yes,
oh,
it
yeah.
was my first time seeing it. I was like, okay. No, I think I had to ask Mark. I called her and like, I don't know what this is. What is this? How do they use it?
Yeah.
Yeah.
But
So,
funny enough, we had that in Jamaica as well. But the thing is, it was like multi patients. Like I'm just trying to make up a word here, but we use it for like a lot of patients. So we had to get like the insulin syringe and pull out the amount that we
that's
wanted.
the one we have in Nigeria.
Yeah, but
No,
one,
this one is the pen.
Yeah,
that's one that you just screw it and then you put the needle. Yeah. So we could be they have it in Nigeria. So parts like Lagos, Abuja, bigger hospital, and
yeah.
they might have it there. But where I trained or where I worked, we didn't have it there. So it was so terrible. But thankfully, I had the support and I was able to learn. And I took every step. I was learning as
Yeah.
I wasn't even shy to ask questions. I was like, I wasn't shy. I was like, please, what is this?
Yeah.
What is this? And that's something that people that want to come into the US to work as a nurse, if you're Jamaica, if you're a Nigerian or you're African and you want to come into this country or even in England, any other country, and you're scared that how am I going to cope, don't be too scared to ask questions. As little as anything, ask. Because if you don't ask and you make mistake, you'll be in trouble.
So it's always better to ask, right?
Yes, better to ask.
Exactly, because to be honest, even though I would say Jamaica is the practice, the level of nursing that we practice in Jamaica, it's like basically roughly the same that they do in England there. But there, when I came to America, back that time in Jamaica, we were still paper based, so we didn't have like computers pushing around scanning patient or anything. Yeah, so most of our stuff was still paper based. So it was very important to us as well to like ensure that we ask the relevant question and so that we don't make any mistake that we can basically prevent.
Very important.